In today's episode, I will tell you about the early signs of liver problems that can help prevent dangerous consequences. The liver is the largest internal organ in the human body, performing crucial functions such as neutralizing foreign substances, removing excess hormones, storing energy reserves and vitamins, as well as participating in blood clotting and much more. Therefore, problems arising from liver diseases affect the entire body. In general, the peculiarity of liver disease progression is that the organ lacks pain receptors, and ailments progress without pronounced pain syndrome. A person feels pain only when the liver has significantly increased in size. It is important to pay attention to the manifestation of any worrisome symptoms. A healthy liver is the foundation of a healthy life, so it is crucial to timely identify the primary symptoms of liver diseases and problems and start treatment immediately. These are signs of liver problems before we delve into them. I would like to ask you to subscribe to the channel. Most liver pathologies progress without visible manifestations, and the problem can only be detected through laboratory test results. If there is a predisposition to problems with this organ or other factors that provoke their development, it is recommended to undergo periodic examinations. In the development of liver diseases, it is important to detect symptoms early. Even the slightest deviations should not be ignored. To do this, it is necessary to know what signs may indicate problems with the liver: skin itching and peeling. Liver cells actively produce bile, which plays a direct role in the processes occurring in the digestive system. After processing in the liver, bile is directed to the gallbladder through special channels. In case of the slightest disturbances in liver functionality, bile begins to accumulate and ceases to flow, which, in turn, leads to its stagnation. Subsequently, these factors provoke itching and peeling of the skin. Sometimes painful sensations are observed. A problem of this kind indicates an overload of the liver or the accumulation of a large amount of bile acids in the organ's tissues. Itching with liver problems can be localized on the soles of the feet, palms, and other parts of the body. With this symptom, it can be noted that it intensifies closer to the night, and with body warming, for example, after taking a hot shower. Changes in the skin from other typical dermatological manifestations can include pinpoint hemorrhagic rashes, multiple bruises, cholesterol deposits in the form of yellow plaques on the knuckles, elbows, and soles. In cases of prolonged liver diseases, characteristic changes in the palms are observed. Palmar erythema may occur symmetrically, redness of the skin in the area of elevation of the thumb and little finger. When pressure is applied to the skin, it becomes pale, then returns to its previous color. Cracks on the heels. The liver should constantly produce bile, which helps the body saturate with these fatty acids, as well as vitamins E, C, A, and B3. These vitamins are necessary to maintain the tone of the skin. In case the liver functions poorly or improperly, cracks on the heels. The liver must constantly produce bile, which helps the body saturate with these fatty acids, as well as vitamins E, C, A, and B3. These vitamins are necessary to maintain the tone of the skin. In case the liver is functioning poorly or incorrectly, bile is produced in insufficient quantities, and as a result, the body does not receive the necessary substances. For this reason, the skin becomes dry. If the problem is not addressed in a timely manner, it can lead to complications. Therefore, it is necessary at the very least to adjust the diet and observe the drinking regimen. It is better to enrich the diet with greens, vegetables, fruits, berries, and whole grain cereals. Edema. Liver problems can lead to kidney and vascular issues. Disruption in the functioning of this system leads to water retention and the accumulation of salts in subcutaneous tissue. This is expressed in the appearance of pinpoint edema, primarily on the legs. Hair loss. Often, accelerated hair loss is observed in liver diseases. The liver processes almost all the nutrients that enter the body. If the liver's function is impaired, the supply of building materials for growing tissues is affected. Therefore, wounds heal more slowly and hair can fall out faster. Increased sweating. If the concentration of harmful compounds in liver cells is high, The organ begins to work in an intensified mode. This leads to symptoms of excessive sweating, an increase in body temperature. Constant fatigue. If a large amount of harmful substances has accumulated in the liver tissues, the body directs its efforts to purify it. This results in strong fatigue, exhaustion that does not subside even after a good night's sleep. Sleep problems. With a high concentration of harmful substances in the body, the production of cortisol, a hormone that controls sleep, intensifies. This affects the falling asleep process. Persistent sleep problems can be detrimental to health. Be alert if there is increased drowsiness, difficulties with concentration, a sense of apathy, and a depressed mood. These are the first signs of liver problems. Fever. High temperature usually indicates an active inflammatory process in the liver, gallbladder, or ducts. Febrile fever accompanies diseases such as acute cholecystitis, cholangitis, hepatitis, active cirrhosis, liver abscess. Unpleasant breath odor often occurs when the liver begins to work tirelessly, making every effort to clean and remove harmful compounds from the body. Jaundice. Parenchymal jaundice is caused by damage to liver cells and usually develops gradually over an extended period. Thus, the patient does not notice its appearance. The sclera and soft palate yellow first, the underside of the tongue, later the palms, soles of the feet, and then the entire skin turn yellow. The color of the skin in hepatic jaundice is saffron yellow or orange. Mechanical jaundice is a consequence of blockage of the common bile duct by a stone or tumor. It arises suddenly and develops very rapidly. The skin color ranges from greenish yellow to dark olivey. Pruritus is accompanied by obstructive jaundice. Abdominal enlargement. Almost all diffuse liver diseases are accompanied by an increase in its size. With portal hypertension, the spleen also increases simultaneously with the liver. In emaciated patients, there is pronounced asymmetry of the abdomen with a noticeable bulging of the enlarged liver. Flatulence. The cause of flatulence is difficulty in digestion. With portal hypertension, fluid accumulates in the abdominal cavity. Its volume can reach several liters. The abdomen with ascites looks saggy, and the navel protrudes. Spider veins appear due to worsening of the condition of blood vessels. Red spots on the body. With serious liver problems, red or brown spots begin to appear on the body. This rash can extend to the soles of the feet. The points appear due to deterioration of the condition of blood vessels and impaired circulation, specifically in the lower parts of the legs. The primary signs of circulatory problems manifest first. Dyspepsia. Liver diseases can manifest dyspeptic symptoms such as belching, nausea, vomiting, diarrhea, constipation, a feeling of heaviness after eating, and bloating due to increased flatulence. Qualitative changes in stool occur due to impaired digestion and fat absorption. That concludes the video. On the channel you can find many interesting videos about the benefits and harm of vegetables and fruits, as well as about diseases and their treatment methods. Therefore, please do not forget to subscribe to the channel, click on the bell. I would appreciate it if you like and share the video with your family and friends.